Alright, hi Miss Warnhoven. My name is Abby. I'll be your nurse today. Today we will be conducting a head-to-toe assessment, and it should take around 15 to 20 minutes, so thanks for coming in today. Is it alright if I ask you a couple health assessment questions first? Perfect. Do you have any allergies? Are you taking any medications? Have you ever had any surgery? Have you gotten injured prior to this at all? Alright, and then does your family have a history of chronic diseases or disorders? Okay, and then have you had any overall health changes in the recent past? No? Okay, perfect. We're going to continue on to the head-to-toe assessment then. First I'm going to be assessing the skin, hair, and nails. And first I will inspect the skin for color, appearance, and moisture. Color is even and consistent with patient's ethnicity, and then appears to be soft and dry and has a warm temperature and no bruising or lesions. Next, I'm going to palpate the skin for temperature and texture. Perfect. It is warm bilaterally and dry. And next, I'm going to test for mobility and turgor. So, right, if I pinch your skin real quick. Patient has elastic turgor, and it returns to place right away. Next, I'm going to inspect and palpate the hair. Hair appears smooth with no flakiness, no bruising or lesions. There's an even hair distribution and has a fine texture, and the quantity is expected of the patient's age. Next, I'm going to inspect and palpate the nails. So the nails appear pink and rounded. There's no spooning or dents. And then if you put your nails together like this, perfect. There's no clubbing. And then if your palpation, the nails are not brittle, and they have a uniform thickness and a smooth consistency. Next, I'm going to test for your capillary refill. Patient's capillary refill is less than 2 seconds. Perfect. And next, I'm going to conduct a head, eyes, ears, nose, and mouth, and your face. First, I'm going to inspect the head. Head appears to be symmetric and upright. And next, I'm going to palpate for the temporal arteries. And let me know if there's any pain or tenderness. No pain or tenderness noted. Next, I'm going to assess the face. First, we're going to inspect the cranial nerve 7. So if you could raise your eyebrows and wrinkle your forehead. Perfect. And then if you could smile without showing teeth, smile with showing teeth. And then if you could puff your cheeks, perfect. And then next, I'm going to inspect your eyes, and so if you can squeeze them shut, and I'm going to try and open them. Perfect. Cranial nerve 7 is intact, and next I'm going to assess the eyes for the sclera and conjunctiva. Sclera appears white and clear, and the conjunctiva appears pink. There is no bruising, lesions, or drainage. And next, I'm going to conduct the Perla test. So if you just look straight at me, shine light here. Perfect. Pupils. And then we're going to see if you follow my finger. There you go. And then look at the wall. And then look back at my finger. Perfect. Pupils appear round, equal, and reactive to light and accommodation. And next, I'm going to test for the 6 cardinal fields of vision. So if you could just follow my finger. Perfect. Eyes appear to have smooth and parallel tracking. Next, I'm going to inspect the ears. Based on conversation, patient has been able to hear and seems to be responsive to questions and understands. Next, I'm going to inspect the external ear. There appears to be no drainage or lesions. And next, I'm going to conduct a whisper test. So if you could just, I'm going to whisper something over here and you can let me know what you hear.
Doctor. Tomorrow.
Perfect. Ears appear to be patient is able to hear. And next, I'm going to move on to inspect the nose. The nose appears symmetric and midline, and then I'm going to inspect the mouth. Lips appear to be pink and rounded. If you could smile for me, teeth appear to be white with no teeth missing. And next I'm going to inspect the gums. There's no discoloration. And next I will inspect the tongue. Appears to be pink with full moisture. And next I'm going to test for the hypoglossal nerve. So if you could put your tongue to the left and then to the right and then up and then down. Perfect. Cranial nerve 12 is intact. And next I'm going to palpate for the temporomandibular joint. Let me know if there's any pain or tenderness. And if you could open your mouth and then close it. Perfect. No pain or tenderness noted. Next, I'm going to assess the neck, and we're going to test the range of motion. So if you could lean your head all the way back, and then all the way forward, and then to the left, and then to the right. Perfect. Patient has full range of motion in the neck. I'm going to next palpate the trachea. Let me know if there's any pain or tenderness. Patient's trachea is midline and symmetric. Next, I'm going to inspect the lungs. So if I could auscultate your lungs for the interior and posterior thoraxes and foresights. Right, and then you could also turn for me a little bit. Perfect. Patient's anterior and posterior thoraxes are clear to auscultation. Next, I'm going to palpate the posterior thoracic wall for expansion. You take a deep breath in and out. One more time. Okay, perfect. Patient's posterior thoracic wall has full expansion and appears to be present and symmetric. Next, I'm going to assess the cardiovascular system. First, I'm going to inspect the overall appearance. The patient appears relaxed and at ease with no unlabored respirations. Next, I'm going to inspect the jugular vein. You lean to the left and then to the right, jugular vein has no distension. And next I'm going to inspect and palpate for the upper and lower extremities for edema. Okay, perfect. No peripheral edema is noted. And next I'm going to palpate for the carotid, brachial, radial, dorsalis pedis, and apical pulses. take off your shoe. If you're comfortable with your sock. Your apical pulse. Sorry, you can put back your shoe on first if you're set. All pulses were palpable with a regular rate and a rhythm of a +2. Next, I'm going to auscultate the apical pulse rate for a full minute. Perfect. Patient has a pulse rate of 90 beats per minute. And next I'm going to auscultate the aortic, pulmonic, Erb's point, tricuspid, and mitral valves with S1 and S2 sounds. For the aortic, pulmonic, S2 sounds were heard better, and then for Erb's point, both were heard evenly. And for the tricuspid and mitral valves, S1 sounds were heard better. And next, with using the bell and the diaphragm, I was able to hear both S1 and S2 sounds. Next, I'm going to move on to the abdomen assessment. First, I'm going to inspect your abdomen. If you could lay down for me. Perfect. You can hold your breath in real quick. Perfect, and then let it out. Patient's abdomen appears to be round, with contour and smooth and symmetric. Next, I'm going to auscultate in all 4 quadrants. Patient's abdomen is clear to auscultation as well as has active bowel sounds. And next I'm going to have some light palpitation that is going to be 1 centimeter deep. Let me know if there's any pain or tenderness. No pain or tenderness found to light palpitation in all 4 quadrants. Next, I'm going to palpate, have deep palpitation. Let me know if there's any pain or tenderness. It's going to be 4 to 6 centimeters deep. Alright, no pain or tenderness through deep palpitation in all 4 quadrants. Next, I'm going to inspect the skeletal system. Stand up for me. First, I'm going to inspect the body posture. Patient appears to have a symmetric posture. Spine appears to be straight with expected curvature. And next, I'm going to inspect the muscle size and symmetry. Perfect. Patient's muscles and size and symmetry is symmetric bilaterally for both upper and lower extremities. Next, I'm going to test range of motion for the legs and the shoulders. So if you could put your shoulders up or your elbows all the way back. Perfect. And then put them and rest them to the side. Next, if you want to step forward and reach your leg back as far as possible. Perfect. And then the other leg. All right, and then we take it. Patient has full range of motion in the legs and elbows. Next, I'm going to assess muscle strength with the spinal accessory nerve. So if I'm going to push down on your shoulders and then just push back. Perfect. Cranial nerve 11 is intact. Next, I'm going to assess for muscle strength in the legs. So I'm going to push back and you just resist it. Push forward. Perfect. And I'm going to hold it like this and push back. Perfect. Patient's muscle strength is symmetric bilaterally with full resistance and have a 5 out of 5 for resistance. Next, I'm going to conduct the neurological assessment. First, we're going to assess the patient's mental status. If you could say your name.
Sanders.
And then where are we today?
In the CFL.
And what day is it today?
Tuesday.
Perfect. Patient is awake and alert with ×3 alertness. And next, through evaluation of patient's speech, patient appears to be reactive to conversation so far. Sufficient volume and response that indicates understanding. Next, I'm going to observe the patient's gait. So if you could stand up for me and walk forward. And walk backwards. Patient has symmetric gait with upright posture. And next I'm going to conduct the Romberg test. So if you could close your eyes and just try and stay standing. Perfect. Patient tested negative for the Romberg test. And next I'm going to assess for deep-tended reflexes bilaterally. So you can take a seat. I'm going to test your patellar reflex today. Don't have to sit there. Perfect. Patellar reflex, it has expected response. All right, seems like everything is good and healthy. Thanks for coming in today. Have a great day.